Let's talk about lichen sclerosus. It's often misunderstood, misdiagnosed, often not diagnosed, and often thought that woman has recurrent yeast infections or similar signs to someone who has GSM, genital urinary syndrome of menopause. So what is lichen sclerosus? We're learning now it's an autoimmune inflammatory condition that can destroy a woman's anatomy, cause scarring, often presents first as itch. A lot of women think they have a yeast infection. They actually do respond to yeast medication because some of them are anti-inflammatory, and hence that perpetuates the use and delay of diagnosis. And if left untreated, there is a risk of squamous cell carcinoma. So it is worth getting yourself diagnosed. And also a lot of women get pain and tearing and even then can't have sex. So it really can affect their intimacy, their well-being. Women will often say it's always on their mind. They always feel uncomfortable. It sort of takes them out of the present moment. And the traditional treatment is usually clobetasol, sometimes tacrolimus, which can help in a lot of cases, but often still women can still have ongoing scarring or pain or other issues. And so having a comprehensive approach is really important. Why? Because we're knowing that it's an autoimmune condition. So sometimes eating certain foods can increase leaky gut, which now we believe also increases the risk of autoimmunity. That stress and having a co-infection like a bladder infection, a yeast infection, BV. I see a lot of people with ureaplasma, they probably have had for many, many years, and nobody does those swabs routinely. So it often can go undiagnosed and miss, and that can also precipitate lichen sclerosus. And what I've seen in my patients over the last 2 years or 3 years is that oftentimes patients will say, oh, I had COVID, and then 2-3 months later, I started having all these symptoms. So somehow, again, this infection precipitated the autoimmunity. And also lack of hormones. So being in perimenopause and menopause can also aggravate it, low testosterone. So it's not just here's your cream and go and we'll see you in 3 months, 6 months. And often a lot of doctors actually don't prescribe even the steroids properly. They're underdosed and there's no real follow-up. So I think this is a very important topic. I think women are suffering in silence, and I just want them to know that there are options. There's a lot of different treatments besides the steroids, and often, there's some diet changes, replacing deficient nutrients, ruling out other autoimmune diseases, treating co-infections, but also there's regenerative treatments like PRP, a modified O-shot that I've developed, as well as using energy-based treatments like the CO2 laser, if used with the right protocol, can definitely be helpful. And then I've developed another protocol using radio frequency microneedling, also incorporating PRP and exosomes as well. So, if you want to know more, you want to get checked out, DM us, book an appointment, love to see you. This is a condition that is dear to my heart, and I don't want anybody to suffer more than they have to. And so if we can do something to make you feel better, why wouldn't you? I know this topic is very sensitive. A lot of women don't like talking about these things, but I think we need to talk more openly about this. And, if you're not comfortable talking with your regular doctor, I would love for you to book an appointment because it's so important. This affects every part of your well-being, your mood, your femininity, your sexuality, your ability to feel present in your life, because I understand it can be very consuming and overwhelming, and there are solutions. So yes, I'm a doctor talking about sensitive things, but let's start the conversation and let's get more people getting help. Questions, comment, DM, book an appointment. We're here to help. And if there's anything else you would like me to talk about in future videos, please let me know. Thanks, everybody. Till next time.